Fatigue, so common in practice, and having a good framework for how we assess for fatigue is so helpful and vital in terms of managing treatment appropriately. Lab tests, of course, play an important role in this, and these tests that we use here will be familiar to us from the previous section. Important tests in this fatigue assessment include the CBC, or the complete blood count, the WCB differential, or the white blood cell differential, and we'll dive into that in a moment. We, of course, should be thinking top of mind about iron levels, and a good iron assessment is going to include that most valuable iron measure. That's our ferritin or stored iron assessment. We'll, of course, look at vitamin B12 as well. We know that blood sugar plays an important role in how much energy we have, and we want to make sure that somebody's not dealing with blood sugar levels that are too low or too high. And we should be familiar with our TSH value as that initial screen for assessing thyroid hormones. We know that if TSH is too high or too low, that can indicate a low or a high thyroid function, and a TSH assessment in fatigue is definitely appropriate. Additionally useful tests could include vitamin D, LFTs or liver function tests, and last but not least, some kidney function tests. This kind of rounds out our initial screen for why somebody might be dealing with fatigue. If all of these come back normal or if fatigue's persistent, we might dive even further and do things like assess for antibodies and inflammatory markers. But this is a very useful screen, and we can use this case example to help guide us through and a better understanding of what's happening here.